Hello, my name is Isabel Diaz, and I'll be evaluating a series of X-ray. So, just evaluation criteria for this X-ray for a proper X-ray. The main thing should be in all images about proper collimation around the body part of interest. Depending on the patient's condition, if it's possible, should be extended, fully extended. Um, Condyles, femoral condyle should be parallel to IR. This is, lateral condyle, medial condyle, um, tibial, eminent, tibial plateau, medial and lateral, intercondyle eminence. Fibula should be slightly superimposed over lateral condyle of the tibia, and patella should be fully superimposed over femur. And this depending on the patient's body habitus, should be 18 centimeters of the pelvic area or below, should be with angulation of 5 to 7 degrees cutoff. If the patient is 19 to 24, is 0 degrees perpendicular to IR, or 25 above, should be about 5 to 7 3 to 5 degrees cephalic. In this case, I did my patient 5 degrees cephalic. And next we're gonna see AP oblique with medial rotation. With medial rotation, there should be a fibula in tibia joint. It should be a little bit more opening in there. Still you see some opening between it, femoral tibial joint. The patella should be more superimposed, more on towards the medial side. Again, for a good X-ray, should show some collimations around and proper market of the body part. The next one is the patellofemoral joint. For this one, we just need to see the joint. We don't need to see the whole knee. So the main thing is interest in here is to see the patellofemoral joint. It should be opening. This is the tangential, axial tangential for patellofemoral joint. And like I say, it should be opening, and this is all what we need to see for a good X-rays. The next one is my lateral view. For lateral view, we should see the condyles, femoral condyles should be superimposed. To get a superimpose of condyles, we need to have our central ray angle about cephalic about 5 to 7 degrees. So because the condyles middle side is a little lower than the lateral side, so that's why we angle the two, to have a little bit more of superimposition and opening of the joint. The patella, it should be right in profile. Our fibula is just slightly superimposed over the tibia lateral side, and collimation around it, we should see around our area, and that's our lateral medial lateral knee. And our next view is going to be the intercondylar fossa, which in this case I choose to do the cam Coventry. With this one, we have our patient prone, and the knee is gonna be flexed about, you know, the 20 to 40 degrees depending on the patient, and you know, to have a better view of the joint. Right here it should be about, you know, 40 degrees, and in this case our central ray is gonna go about, you know, 40 degrees cut out. Our patella is right superimposed, or, you know, over femur, and it should be a good opening, you know, towards, you know, the femur. Again, a tibial plateau is right here. Tibial eminence and intercondylar fossa is, you know, open completely. Again, we have to prove, you know, a collimation around it, and well, this, because I got these x-rays from internet, I don't have my market, which I did market on my actual x-ray. With this conclude all you know, images from knee, so which is, you know, AP knee, AP oblique with medial rotation, lateral medial lateral view, tangential patella, and the intercondylar fossa. Okay, thank you.